All right, well, we're at the top of the hour. I'm going to go ahead and kick us off. Again, thank you to everyone for joining us today for our, I believe this is now our third industry expert panel since COVID-19 started. As a quick reminder for those of you that may be new, all the participants will remain on mute today throughout the webinar, so you do not have to worry about any distractions in your world impacting the quality of the presentation that's going on today. But what that does mean that if you do have questions for the panelists, we need you to submit those through the Q&A. Just look at your Zoom control panel, find the Q&A button, click on that to open it up, and you can type in a question that we can ask the panel. All participants can see those questions, so if you want to upvote or downvote so that we can prioritize them, because oftentimes we do get a bunch, please make sure you're watching them and letting us know if you'd like to see that question answered by the panelists. As is our practice, we use our access to all of you industry experts to gather some information. So we will be running 3 polls again today. One is specifically for venues, asking them some questions. One is for planners, and one will be industry-wide that will mirror the one that we asked on the last expert panel so that we can kind of gauge the difference in feelings between a month ago and today. And finally, as we're already doing, if you have comments or other things to share as a part of the conversation, please use the chat box to do that. Allie and Neil will be monitoring that today and responding and letting you know what's going on. And as a final reminder to everyone, this session is being recorded, so you will be able to watch it or share it with others after the event. We always post those on our resources page at Unique Venues within 24 hours after the completion of the webinar. And with that, I'm going to stop sharing my screen and I'm going to turn it over to Chuck Salem.
Thanks, Joel. I really appreciate all of the work you're doing to help bring all of these webinars to us. Any of you who might have been on our past expert panels, if you remember correctly in the last one, somebody asked why the person in the lower right-hand corner as you're looking at your screen wasn't being asked any questions or allowed to speak. That's actually Allison. She's part of our Unique Venues team, and she's helping to monitor the chat and question Q&A section. So please don't think we're disregarding her as an expert panel member. She's an expert in many ways. So thank you, Allison, for helping us out today. Let me tell you a little bit about the background of why we put this particular panel together. We've been listening to all of the discussions in our webinars and questions that people are asking, and in addition in our what we call our member group therapy and planner roundtable sessions. And one of the questions that's come up a few times, numerous times, has been concerns about all of the work that people have venues and planners have put into making sure that there are sustainability efforts that are practiced for their conferences or at their venues for conferences, and how does sustainability coexist with hybrid meetings and meetings during this pandemic and after the pandemic. That's certainly not solely the focus of this session, but that was what kind of led to this topic of safety, sanitation, and sustainability. So we put together an expert panel today. Unfortunately, one of our panelists was unable to make it. Especially those of you that do work in higher education know that urgent situations arise and you have to jump out, and that was the case with Steve Holland, who's our Chief Safety Officer. But what we've learned is we've got some of that background still here on our screen today. It's kind of the things you learn about people. I also, before I introduce the panelists, want to say that this is a time, one of the silver linings for us at Unique Venues during the COVID-19 is the number of people that we've met and that we've begun networking with, and how we've expanded connectivity in the industry with outstanding professionals. And the 3 people that I'm about to introduce you to are included. I'm going to start with Sean Anderson. He's a longtime friend and client of Unique Venues. He's the global president of IAC, as well as the vice president for Sodexo Conferencing. Again, we've been working with Sean for well over a decade and representing a number of the conference centers in their portfolio, and also been very actively affiliated with IAC. So thank you, Sean, for joining us today.
Hi, Chuck. Thanks for having me.
You're welcome, sir. And the second person I'd like to introduce you to is Andrew Cohen. He's the managing director at Horwath HTL, located in Miami. He is somebody I was introduced to. Some of you have been on past panels. Remember Leora Lanz, who's a faculty member at Boston University School of Hospitality. And when I was talking to her about speakers for our session today, she said, I have just the person for you. And she mentioned Andrew. And then Patty Olinger is the executive director at the Global Biorisk Advisory Council, GBAC. And for those of you who have been following, we came upon GBAC through an article about a particular unique venue site in Miami, Florida, Hard Rock Stadium, who was talking about how part of their program was to get involved with the GBAC program. Read it, I believe, in USA Today. Joel sent me the article. We got right on it because we felt like that was a good potential solution for our venues to be able to know and access information and take some of the course and accreditation programs that we'll let Patty talk about while she's also imparting some of her expertise. So it's just, and she also comes from a background in higher education. She worked for Emory University. So thank you so much, everyone, for joining us today. So I'm going to start with my first question, and that is that many people are talking about hybrid meetings. In fact, we are now in the midst of a three-part webinar series about developing and implementing effective hybrid meetings. And people are starting to take the first steps towards gathering again. And of course, wherever you're at in the US or Canada, it really depends on at what stage you're in at this point, how large those gatherings can be. When it comes to the safety of attendees at these hybrid meetings, what are some of the most critical measures that a venue can take to provide a safe environment for the people who will be there in person? Let's start with you, Patty, if you don't mind.
Sure, and thank you for having me, Chuck. This is a wonderful opportunity to work with you and your membership. So, there are a couple different things to think about. First of all is our own personal behaviors, and that is that, ensuring that we're washing our hands, those things that we're hearing from CDC and the World Health Organization, wearing a mask, keeping our social distancing, thinking of those things that we can control ourselves. And that's really important to remember. And then from a venue standpoint, what types of things can we put in place to implement to make those behaviors easier in some respects, making sure that we have hand sanitization stations in places, making sure that we may have to look at temperature monitoring programs. How do we implement those? What's our cleaning and sanitation rules? And being very transparent about that to the people who are going to be visiting our venues.
Thank you, Patty. Andrew, would you like to also provide some insights? Oh, you're on mute.
Okay, sorry about that. Actually, I have a technical question for Patty. Down here in Miami, we have a lot of meeting places that have ceiling fans. Is it helpful to shut them off or to have ventilation? We hear that indoor is more transmission friendly than outdoors, but I don't know if we want to be stirring around the air indoors, if that'll just increase the velocity of the particles in the air. Do you happen to know?
That's a great question. And the reality is that I'm going to do the biosafety answer that a lot of biosafety professionals are going to say, and that is, it depends. And that would be one of those that you'd have to look at the venue itself and do a quick risk assessment to see, are you getting air changes? Are you just stirring up the air? And, there would be a few different parameters to look at from that standpoint.
Okay, thanks.
So yeah, the air handling mechanisms that you have in place are really what's going to create the actual response to that. If you've got air handling in place that pulls air up, cleans air, whatever, I guess is going to be the real question that the venues should ask about from their own physical plan.
Sure.
And Sean, you're a venue, you've got a whole portfolio of venues. So I'd love the venue perspective on this question about the most critical measures that venues can take to provide a safe environment.
Sure. There's a long list, Chuck, but I'll just grab something that Patty mentioned, and she said something about risk assessment. So let's just talk about that, because this is not, this is not your grandfather's risk assessment or even January's risk assessment, right? This is looking at every area of the venue and break it down, right at the entrance, the lobbies, your reception and meeting spaces, restrooms, the pub, the guest rooms, all of that, and to break down every single area, because in this current situation, those are all going to be treated very differently, and they all need a customized approach. And so to oversimplify, but to maybe give you the best place to start, that's a good place to jump in, break down every single level of it. And quite frankly, just maybe to get off directly the safety piece, although it's related, same thing on the service side in every single one of those areas. You're going to want to look at what you can do safely and what you can do well, and just do that. Because where we sit today, we risk a little bit of a disconnect on the service expectations versus what we can really deliver as a venue. And so you're going to want to be real clear, communicate that, but you've got to do the homework up front to make sure you understand what you're capable of doing, and just make sure you do that very well.
So from the planner side, what I hear you saying is, from the planner side, to have a clear set of expectations for what the venue will deliver to them from a safety and sanitation standpoint, and for that venue to clearly have a communication line open with that planner to make sure they can deliver on that. Because this is a time when we do have a habit in the hospitality industry of sometimes overselling ourselves,
Totally.
right? But when it comes to an issue like this and the risk and liability that comes along with it, we don't want to have to back into expectations. We want to be able to meet those with confidence up front. Is that fair to say, Sean?
Totally.
Okay.
Totally. Yep.
So my next question, we're going to start to go deeper now, is that I have sanitation's a must in today's business environment and in life in general. We all live it each and every day. I was reflecting yesterday that when we all first started wearing masks, you were like, I don't want to wear a mask right now. I'm going to be like the only person wearing a mask, and I'm going to feel silly, and everybody's going to look at me and think I have COVID because I'm wearing a mask, right? Remember those days back in late March, early April? And now we've transitioned to that time when we're all looking at people who aren't wearing a mask, kind of like, you're not wearing a mask. You really need to. Or states where I live, you can't go in any place without a mask on, right? You've got to have that. So we really transitioned to that. Knowing that this is sanitation so important, we did, as I said earlier, partner with GBAC to provide some learning and accreditation opportunities for venues. And the nice thing I can say is that Unique Venues isn't monetizing this. This is truly a program that we're bringing to our venues so that you can be the best that you can possibly be at practicing safe sanitation practices. With that said, I want to ask Patty if you could tell us a little bit more about GBAC and the programs offered. And even more importantly, how did you arrive at the conclusion that the measures you're suggesting are the ones to implement? Like, what was the science behind the programs you put in place?
Sure. So GBAC is actually, it's no longer a new division, but it is a division of ISSA, which is the International, Trade Association for the Cleaning Industry. And I joined GBAC and ISSA last September, and GBAC really became part of ISSA mid last year. We had put together the whole Global Biorisk Advisory Council, right after the Ebola 2014, I'll say, situation that we all dealt with. At Emory, I was part of Team Ebola that I provided the support to the team that treated the 4 Ebola patients there at Emory, and have been involved in biosafety, biosecurity internationally for multiple years. And what we found is that when we looked at different disciplines, there was really gaps in our industry, whether it's in biosafety or professional disinfection or the cleaning industry or high-level cleaning, where you're looking at forensic restoration, crime trauma, hoarding, unsanitary conditions. We had gaps. And so we looked at the training and certification needs in the industry. John Barrett from ISSA said, our industry in cleaning really needs it, because what we're doing right now is really, if it looks good and smells great, hey, we're good to go. And that we're not really removing, that hygienic cleaning. We're not doing it. So he had this idea of bringing GBAC in as a division of ISSA, and we did that. Lo and behold, I wrote an article last fall that was published in January that a pandemic is coming and we're not prepared from cleaning and disinfection standpoint. And that came out the week before the pandemic really hit us in January. So we had to pivot very quickly because all of our training had been face-to-face, really face-to-face competency, hardcore, donning, doffing, how to use this equipment, putting people in suits, the whole bit. Well, you couldn't do that as of February, basically. And so we went to an online program, and the need was that frontline worker, those who are really working. So that's where our one product that you're familiar with is that training online for basic fundamentals of cleaning, disinfection, and really focusing on COVID-19. Well, we found out really quickly that that wasn't what people really wanted. We were ready to launch our GBAC STAR program this fall at our show. We were working on it, let me put it that way. It was going to be launched, and John came to me and said, we really need to launch this right away. Venues need to have some way of being able to show confidence that they have these programs in place, that they're ready to open, that they're looking at things from a cleaning, sanitization, and infection prevention measures. Our social distancing, our temperature monitoring programs. What are we going to do for our venues, our facilities, to help them relay the communication to people that they're ready to reopen and they can do it safely? So that's, our scientific advisory board has members who have put a lot of effort into this, from CDC that have recently retired from CDC, Health Canada. We have a lot of experience with WHO and international guidelines development in this area and infectious diseases. And then those who are really at the front line, who decon planes that brought in folks from Wuhan, China, or Diamond Princess, or that decon at CDC in different areas of that. So a lot of very unique individuals who provide support and scientific input to our guidelines.
Excellent, excellent. And just real briefly, there's two levels of the GBAC program. There's an online course, and then there's a more in-depth accreditation. Is that correct?
Well, the online course is for the individual, so anybody can go out and take that course. And if nothing else, taking that course gives you a better confidence that you at least understand, how to break the cycle, of infection, or the chain of infection, how to do it safely, how to do a basic risk assessment, looking at what personal protective equipment you might need or your team might need. And then the accreditation is really a facility accreditation program. So we get into much more detail on that. It's based on 20 elements, very quality management program, needing to look at your SOPs, the equipment. I know that people are concerned about the chemistries that they're using with regard to their lead building certifications or something of that. So we look at those different elements that go into a total program.
Great, thank you, Patty. And just so you know, we have a slide towards the end that has more information on those GBAC programs that we're affiliated with here at Unique Venues, as we provide just basically a link to your opportunities that we've worked with them on. So thank you for that. But now I want to know, Sean, as a venue provider, what measures do you feel need to be taken into consideration regarding sanitation that maybe she talked about? How would you like to add to what Patty provided for us?
That's a great question, Chuck. And there are probably 1,000 different ideas, and maybe that's not even enough ideas around how to make sure you get the sanitation right. But we can start. So here's one everybody will understand, is all around the physical distancing. And so just to speak to the importance of that, you're talking about from outside the venue when guests arrive, making sure you have prescribed traffic patterns, scheduled arrivals, all the traffic flow. I don't know if everybody's fully informed on the two sides of that. So one is to keep people physically distanced for all the reasons we probably know. The other reason for that program, and to make sure that it's strong and in place, is to allow for the cleaning and sanitation that you need. So you know what the guest patterns are, how frequently they travel through those areas, you're trying to schedule those. for a variety of different reasons, but one is to make sure that you can schedule the regular cleaning times. Other things that you want to look at, are you, prior to guest arrival, are you looking at electrostatic disinfection? Is that the most effective method to you? I think you heard it earlier today, sanitizing hard surfaces, high traffic areas, making sure that you have hand sanitizers available. And then also look at something like if you have guests who are maybe just a little unsure, they're willing to come to the meeting, but they're just a little bit nervous. Look at things like the appropriate use of PPE, and there are PPE vending machines, believe it or not, already. Do you put that into your space so that if people just feel more comfortable with that, give them a chance to do that? Again, there's a long list, Chuck. When you get into food service, are you no contact? Are you limited contact? I think right now venues have to reach out to their local authorities and understand what the rules are, but there's just a lot that we can be doing, I think.
Right, and so there's really so much. I guess I have a question before I jump to Andrew that just popped into my head, is that what is the legality, I'm assuming there is permission to require people to release or indemnify the venue in the case that they do contract COVID-19 as a result of attending an event? Is there I know this isn't a legal panel, but I mean, I understand there are events where people are talking about doing that. Is that something that you're preparing for at your venue, Sean?
Yeah, and I'd be interested to hear what the other panelists and what their observation is so far. But you're right, we're very much on the front edge of this, Chuck, because the venues are just getting the fire up again. And a lot of times those type of issues need to make their way through some conversations before there's a clear approach. But what we know is we see a couple things. Number one, a lot of employers, as they're calling employees back from furlough, are requiring a sign off on a document like that. So if you're hosting a corporate event, the likelihood that as a work-sponsored function covers the company, we'll just call it on a limb. Again, no lawyer, at least none sitting in this chair, that you're covered, you're okay. However, for the venues, we've heard an awful lot of momentum just this week about pursuing that thing and talking to legal counsel. And either do they require the group contact to sign off up front, or is that something that they take upon themselves? And they're worried about the legality of it, Chuck, but also kind of the optics and the service perspective all at the same time. So I don't know if that's a firm answer, but your question is spot on because the timing is perfect.
Andrew or Patty, want to add to that?
Yeah, I'll add,
Go ahead, Patty.
Yeah, thank you, Andrew. I'll add a couple things. One is that the legal aspect is going to be very interesting. The whole aspect of indemnifying or releasing liability from a venue. I think that the other aspect of, when Sean indicated, employers requiring that, I think that where they're going to need to be a little bit concerned is from an occupational health and safety standpoint, because they're not going to get released from the OSHA rules or the general duty clause if they are not putting in place some parameters to safeguard their employees. And so that's one of the things that they're going to have to be a little concerned about there from that standpoint of, have they put in place, work practices or facility practices to, at least do something from that standpoint. And so, it's going to be interesting to see how this all plays out from a legal standpoint.
And it is. It's interesting because we've talked about the venue, we've talked about the employee. There's also the responsibility and what's the role of the organization, the sponsoring group who's holding it for their attendees. And are they also going to be saying when you register, you're releasing us too, your group, your organization, the sponsoring group. So Andrew.
Sure. Just to add a little bit, the hybrid meetings that I've attended, one was a local organization here. Usually we meet at our regular venue, have about 50 people sitting around card tables of 4 each. And if there's overflow, some chairs around the back wall. And since the buildings opened again last week here in Miami, we had Zoom for people who wanted to connect from home, and live meetings for people who wanted to come. And the maximum occupancy, given the sizing now, is 20 people instead of 50. So when we connected, I connected by Zoom, and it just looked very strange to see people sitting in chairs with no tables and nobody around them. And it was almost like a modern art sculpture, you know, people in chairs with masks on. And I don't know what the venue can do to make the attendees feel more natural, more comfortable. You know, this is the new normal, and new means change, and change means stress. But we certainly don't want to give clients another reason not to attend because it feels strange, right? So I don't know how you make it feel warmer, but it's certainly a challenge that you want people to feel at home and be happy to see each other and find a way not to hug each other, but, you know, give the elbow or the fist bump, etc. So these are some of the softer touches that have to be kept in mind.
Yeah, I can relay actually a personal experience from just this past weekend. Neil and I ventured out here, Northern Virginia, the DC suburbs. We're in phase 2 now, so we could go to restaurants. And we went to one of our favorite places to dine. And it felt very strange in there because the closest table to us was 12 feet away.
Exactly.
So this place that was usually hustle bustle, right? Like loud noise, very lively, very active. The whole feel of it was very strange. The food was amazing, you know, strange to have people with masks waiting on you and the way they, you know, but I agree, Andrew, it was the whole atmosphere of it just felt very different and something we're going to have to get used to, right? So we're going to be moving to some questions about sustainability, but I think before we do that, we ought to take a break for some questions and see if there's any questions that have resulted from the first two discussions we've had so far. Joel?
Sure. So there were a couple questions that came up during Patty's portion describing, you know, what considerations you need to have for the biorisk hazards. And here are the two of them that maybe you can help with. One had to do with an update on kind of the risk associated with using community washrooms. That was predicated on a blog post, I think, that was shared a while back on Unique Venues about some of the impact of, you know, the splash factor, not to be too gross or anything, from people using public washrooms. And the second one was, what about UV light? Is UV light a treatment source that people should be looking into and considering for their cleaning process?
Those are both very good questions. You know, there is, you know, another reason to wear masks. The aerosol generation from the toilet has been something that's been there's nothing documented as far as what that infective rate or something like that, but they have documented that in hospitals where there's a higher prevalence of virus, that they have been able to, I believe it's in hospitals, that they've been able to at least recognize that there may be some virus in fecal material and everything. That being said, you know, it's one of those things that, again, washing your hands, don't touch your face, you know, those basic work practices that, you know, that we've been talking about to everybody is so important. I think the other thing that we'll start to see is the facility designs differently. Looking at touchless facilities versus, you know, having to open a door and having to, you know, touch the faucet and the whole, you know, you're going to see a lot more touchless facilities going forward. The other one was with regard to UV light. We know UV kills. We do know that. I mean, that's one of the things. But with UV light, there comes, you know, some different things that you have to take into consideration. It only kills where the light hits. So if there are shadows, or if it's not clean, it's not going to penetrate necessarily. And so there's some concerns with that it's not the solution that everybody thinks is the positive. The other thing is that, you know, a lot of folks have been looking at HVAC issues and the efficacy, putting that into a convention center. You know, there's question of, have we validated whether or not there really is that going to be the efficacy that we need to see? There have been some things that we've been questioned about as portals that people walk through. Well, what is it that you're trying to accomplish, from that standpoint, does that make sense? And also the safety aspect of people's eyes and their skin. And there are a lot of things that really are some unanswered questions. And when we've been pulled in to look at it from our scientific advisory board and we ask these questions, you find that they haven't necessarily gone through all the FDA testing. Not everybody, but some of them. But other things where it really makes some sense are things like escalator handrails. There are systems now that they will put the UVC in the escalator handrail system so that when it's coming out, it's supposedly it's disinfected, but yet it goes back through the cycle of being disinfected. I know that one computer company that makes phones, is looking at having boxes in their stores so that when you bring in your tablets and your phones, you put them in the box before your technician would handle it. And so think about the tools that people use in beauty salons and that. There are some really unique situations where UV and UVC, I think we're going to see some new innovation and technology coming forward.
Thank you.
Great. One other note I just want to share with participants on the webinar right now. We've had a couple of questions come in the Q&A in the chat asking questions about our venues, asking for guest lists so that you can help with contact tracing, or venues providing hand sanitizer and masks. Know that it's probably hard for our experts today to answer those questions, but if you'd like to ask them of the group, please use the chat window and just ask that question to all panelists and attendees, and hopefully other attendees on the webinar can respond and let you know what they're doing. And I will note some of these things for future poll questions that we can ask to kind of collect some of that information. And why don't we go ahead and jump back to your prearranged questions.
Okay, great. Andrew, we're going to start with you on this one. Throughout the series, as I mentioned at the beginning, both venues and planners have expressed concern that all of the progress made towards sustainability in meetings and events is being sacrificed to accommodate safety measures. Is there truly a sacrifice, or can sanitation and sustainability coexist? Please give us your insights. We'll start with you, Andrew.
Well, I think we have to define timing as an influence on this question. When the building is on fire, you grab the extinguisher and spray. You don't stop to read the ingredients on the back, right? There are times for immediate action, and the expression isn't sustainability first, it's safety first. So I think we're about 90 days into from the time that most of us started staying at home, and now things are starting to open up 90 days later. I think 90 days is for all parts of our industry to make quick fix solutions so that they can remain open or remain operable. It's somewhat natural to throw the sustainability to a secondary priority. However, now that, well, we're really going to have a few periods of time, right? Because now that we're starting to come out of hibernation and the economy is starting to pick up again, there's the time between now and, say, the end of the year, when hopefully there will be better treatments, like something hopeful was announced this morning with simple steroids that would minimize the fatality of the disease, to the time when we might have a vaccine. And then there's the post-vaccine world, right? So there's the long-term, the interim, and the short-term. I think it's time now for reviewing, like Sean said, each part of your process and put it through now the sustainability tests. If we've changed our procurement, if we've changed the way we store food, if we've changed the way we serve it, now let's look at the environmental, the economic, and the social efficacy of what we're doing. We've made the changes maybe without regard or with less regard. Depends as well on the organization. Do the people who the chief officers of wellness and sustainability are sometimes not at all in the operations group who make the changes and implement what we've done for sanitation and safety. So it's time now, I think, for them to come together and determine for this interim period from now until question mark, but hopefully not much more than the end of the year, how can we now address sustainability? And then going forward, of course, there's always innovation and the standards bodies that can help us with that.
Excellent. Thank you, Andrew. Sean, anything you'd like to add there?
I totally agree with what you just said, Andrew. I'm lucky. I work for a company that really understands sustainability, broad scale. We've been on the global Dow Jones Sustainability Index since it was formed. We're the #1 performing company in our market sector for 15 straight years. So what that means is, Chep, you're going to get your money's worth out of that question if I throw an answer back at you. But it also means it's in our DNA. And so I have the luxury of, and it's exactly what you just said, Andrew. Let's look at the glass half full for a minute and realize where we sit, big picture, and then identify some of the problems and the stumbling blocks that are short term. So bigger picture, right? Planes all over the world are grounded. Nobody's commuting to work. Carbon emissions are down. I can't think of a single organization anywhere that has said they're going to back down off of their sustainability or their social responsibility commitments as a result of C-19. You just don't hear it. Specific to our industry, we're looking at hyper-local food sources. We're looking at sustainable farming. You're looking, when we do reopen, really streamline. Again, just let's look at food for a second, and you can multiply this times your meeting space and your guest rooms as well. But just in the food environment, you're looking at really streamlined operations. You're looking at, what do we do best? Let's do that. Let's minimize the menu. Let's eliminate and repurpose food waste and look at eco-friendly products. People are already doing those things and considering items like corn or potato-based utensils, bamboo plates or utensils if need be. People they think they're doing a real good job now working with their trash company, the refuse, to make sure you understand where it goes. Because if you take my compostable items and you throw them in a plastic bag and they go to the landfill, we've gained nothing. And I think people have knocked off a lot of that. So generally speaking, glass half full. And for the very short, hopefully temporary period that you have to use individually wrapped plasticware in a little plastic so that everybody stays safe, and you have to do that to get the engine warmed up, I think you still win. I think you can't, nothing's ever final. You can't take your eye off of this, but temporarily it may be the best answer. And then just understand that innovation, as Andrew said, is maybe even in the short term going to address some of that, but don't accept it as the norm. It's not going to be. I think we're too good for that now.
Agreed.
Patty.
So I agree actually with most of the comments and all the comments that Sean and Andrew said, except for one thing. I don't think it's going to end at the end of this year. From a standpoint, I think our new normal is that we've got a wake-up call here, and it's time to wake up. It's time to wake up to say, if we get through COVID-19 by the end of the year, that's great, but there could be another pandemic of something completely different going forward. That was why I wrote the article, basically with that thing is a pandemic is coming and we're not prepared. And what we're finding in some of the venues is, I don't think, and I personally believe, and I've seen it, sustainability and safety or biosafety does not have to live in silos. They can work together, and there's no reason. And that's where you look at what it is that you're going to require. And I loved what Andrew said, is sometimes it's the safety, it's economics, it's looking at the personal cultural responsibility issues. It's our buying local versus public, because we can buy something that's sustainable, but if we're trucking it halfway across the country, we're not really contributing to the whole sustainability effort. So we need to look at the big picture of things, and we need to accept that responsibility. And if you're going to bring in something to clean and sanitize something, make sure it works. I mean, that's what we've run into on a couple facilities that, we're LEED certified and we're using this, and it's like, yeah, but it doesn't kill anything. And so, if you're doing that, that's fine, but that doesn't necessarily mean that forget about COVID-19. It does nothing for the flu, and it does nothing for MRSA, and it does nothing for something else. But hey, you're spraying something around, and you're sustainable. So it's given us that glass half full, which I agree with what Sean said. And it makes us be able to step back and say, let's pull it together and let's work together, because we can accomplish this together. You don't have to spray formaldehyde all over the place. In fact, I would be like, no. There are products out there from an innovation standpoint that people haven't even looked at that can be environmentally friendly and also protect us from a safety standpoint. It does not have to live apart from one another.
But I think you need to have a critical mass of people who agree with that philosophy and don't have what we had at Memorial Day down here, which was, I've been cooped up for 2.5 months. It's a holiday weekend. The malls are open again, and let's crowd to the mall. And the masks, well, that was, that's over now. And I didn't mean to say that things would be over at the end of the year, just that hopefully there would be some decrease in the uncertainty over treatments or a vaccine, so that there's another level of behavior. But it amazes me, at least here in Miami, I know it's different in different parts of the country and different parts of the world, but last week people were not using masks in general here. And over the weekend, when all the news was things are spiking and we're back up to as many hospitalizations as we had in April, Monday morning, boom, everybody had a mask on, it seemed like. So, it really, it's not just can we do the science and the behavior together, but are we all aligned as a nation that this is where we need to go, and that we're willing to make some changes in our behavior to have a society where we're less susceptible to these pandemics.
Oh,
and I think that
I think those are two different questions. The behavior issue is no doubt, absolutely. I actually drove from Georgia to Michigan, back to Georgia this last week to see my son. When we were in Michigan and went in public, everybody was required to wear a mask when you were in a public building. And as going home and getting to the gas station, right on the door, it says everyone entering in must wear a mask, and I was the only one with mask. And so those are behavioral issues that, again, we can control. But when we get to the sustainability issues, forget about COVID-19. I've always been an advocate that there's no reason why we can't work together to accomplish the goals of both sustainability and safety. They do not have to live apart.
I agree with you, and it is very complicated, and I think there's a question that popped up here that we'll go to in a minute, I think, with questions, because, I think that Canada, we have people on here from Canada and the US, I think Canada is much more in coordination as a nation with national guidelines, where we are more, 50 states, you decide, here are some minimal, I think there's some things that we have some federal things in place, and CDC guidelines, but they're not laws. But my experience here in Virginia, we went to a coffee shop yesterday. They said you have to have a mask. We went and had a mask. Somebody tried to walk in without a mask. They said, no, sir, you have to have a mask. I don't have one with you. You cannot come in here. I'm sorry, if you have somebody outside who can come in and get this for you, that's great. You cannot come in here. It's really, we have security guards outside of our grocery stores who are monitoring that. Security guards outside of Home Depot, they don't let you in without a mask. You can't go in. So I think that it just really does depend, which is one of the tricky parts for us. I was also smirking at one point because I was thinking about a statement you made earlier, Patty, about just because you basically said something like we felt we were doing things because it smelled good in here. And I'm at this point now where I'm like, I don't trust it if it smells good. In fact, I probably trust it more if it doesn't. Like if it smells very antiseptic, I'm like, okay, this place is probably pretty clean.
There are really great disinfectants that are green and that are sustainable and that are safe, that smell good too. That John Barrett will talk about, we're moving past the it looks great, it's real shiny and it smells good, to having that, but also the validation that we're removing deadly pathogens. and or that we're creating a hygienic environment as well.
Well, good. Thank you very much. One of my sad things about wearing a mask, it occurs to me all the time that nobody knows when you're smiling at them, right?
No,
So, you know,
that's true. It is.
I smile at people all the time, and I realize they have no idea I just smiled at them. All right, Joel, questions before we go on to our next question?
Sure. There's a couple questions again that came in. One, I think, circles back a little bit to the liability question that we asked before. It's wondering about a balance between the employer's responsibility to safeguard employees and the employee's responsibility to safeguard themselves. So, should employers be responsible for providing masks to employees as they come back, or is that going to be something that's the responsibility of the employee? And are there minimum standards that we should specify for masks? For example, the perception is that bandanas do next to nothing because of the type of material. So what are the feelings about kind of the liability associated with who should be required to provide the PPE, and is there a minimum standard we should be shooting for?
So I can, am I unmuted, Chuck? Can you hear me?
You are.
All right, thank you. So, Joel, that comes in two ways. So one is guidance and what experience are we seeing right now? And then the other is absolute legal advice. And I think here's the big cop out. You're going to get the absolute legal advice when somebody does something that someone else doesn't approve of, and it ends up in court and you've got a precedent, and then people are going to weigh in and say, okay, this is the right way as determined by a judge. And that hasn't happened yet. But what we're seeing, to talk about that, employers required to provide PPE in any area where PPE is required to do your job, as specified for now. If you default to the CDC, if they say certain PPE is best practice, then the employer required to provide that. Otherwise, we're not seeing employers step in to provide PPE on a broader basis. Is that how that story is going to end? I don't know. That's how it sits right now.
I think that the jury is still out on, like I totally agree with what Sean just said. I mean, you have the difference between occupationally related personal protective equipment or respiratory protection needs. And when you fall into that, they have to meet certain performance requirements for a respirator, say. If it's a medical device, like a medical mask in a hospital, it needs to also meet FDA requirements. When you start getting into public health, there are no requirements right now. And so that's where we're in, and I mean, there are materials out there that do filter. But we haven't, I think we're going to see some innovation come through where you will see, I'll say, public health face coverings, whatever we want to call them going forward, that will do a better job of at least filtering something. But to wear a respirator all the time is, I mean, I've talked with some medical professionals who said we will probably see some pulmonary issues in the future, short-term future, because people are wearing some type of filtering device all the time, especially in our healthcare organizations.
And I think one of the things I remember was an article from maybe 6 weeks or so ago where it really talks about catching the virus as a combination of both exposure and time. So you can pass someone, and unless like a big drop of spittle or something ends up in your mouth, you're probably okay if you just pass them. That's why grocery stores are still considered low risk and things like that. But if you spend 4 hours in a meeting sitting 6 feet away from someone and you're constantly, and so the idea behind masks really is more about protecting you from some of the larger transmission mechanisms, both from anything you might pick up, but also anything you might be putting out. And so really any kind of protection is a step in the right direction. And you don't have to go all the way to the nth degree to eliminate, some of the possibilities of transmission.
So now I'm going to ask, I'm sorry. Now I'm going to ask a silly question based upon what Joel said. I think it might be a silly question, though. They say no such thing, right? Mm-hmm. But is a solution, not a solution, but maybe a preventative measure for meetings and events to have shorter sessions, more breaks, more opportunities to move and circulate in the space integrated in? Or is that, listen, it doesn't matter, you're all still in the petri dish here, you're all in this room, and you're all in here already, movement in that room doesn't make a difference. Because when I go to the grocery store, I'm in the grocery store for an hour, right? If I go for a long grocery shopping trip, I try to eliminate it. I go to the grocery store, I'm in there for an hour. So is it really any different than being in a meeting room for an hour? I guess that's a question.
I think
But
that
I'm always moving in the grocery store. That's
yeah, I think that the answer is we don't know. I mean, unfortunately, I don't know I don't think anybody really knows the scientific answer to that question. You know, if you were saying that you were, you know, going in and out of that meeting room, if you have parameters in place for, you know, temperature monitoring before anybody comes in, you're wearing masks, you know, maybe when you change the room out, you have a quick disinfection step that's going in place. So if there is anything, you're reducing that viral load. You know, I mean, there's so many different pieces of that puzzle that you would have to answer. And so, you know, so nobody really knows that true answer to that question. And that would matter. I mean, it could be the flu that you're talking about.
Yeah.
And add traffic control to that, Chuck, everything Patty said, right? And then add on to that when people leave, where are they going? And have you, first thing in the morning, you know, we have a lot of venues, right, that'll do a safety moment in the morning. I think that script changes a lot now, and it includes things like what Patty's talking about. When you leave, here's the prescribed times that we have for you to break. We're going to come in and clean the room. But also, where are they going? Because if they all go congregate in one central area around a reception desk, pretty much defeated everything you did to try to set up for success.
I knew we wouldn't get to all the questions, and I may have over-prepared. I have a lot of questions here. So I see we only have 8 minutes left. Joel, before I ask the panelists their last question that I'm going to ask today, are there any other questions that have been upvoted by folks here that we need to get to or should get to?
A quick 1 minute answer on considering the validity of digital temperature gauges that places are starting to think about for entering venues or businesses or whatever. How valid are they? Is that a good way to actually look at and try to prevent the spread of COVID-19?
So I'm familiar with some of them. I mean, obviously, it's like any piece of equipment. Some of them are more valid than others. There are some that you walk up and they measure your face, and that have been used in hospitals for the last several years. That, you know, gives you a little temperature that basically says that, you know, you're well today. And you know, like I said, some of them are much better than others, and especially if you have a temperature, and even that is of discussion, because if you go to CDC website, you'll find 2 or 3 different temperatures that they recommend. If you go to WHO, it's a different temperature. And so you have to go through that and look at what it is that you're going to do, and then be consistent, and then look at the equipment that you're going to use, and does it have, you know, like anything, if you're buying something, does it have good ratings, and how is it being validated?
And the other thing is that may be an indication of active infection, but you can also transmit when you're pre-symptomatic. So it's not a guarantee that you're well, but it is a filtering of, you know, you can get the most typical suspects out of the crowd beforehand.
Yep.
Go with your last question.
I'm going to go with my last question. And I like to ask this for each of our expert panels that we're really honored to have you with us today. Thank you so much. I mean, we have kept people super engaged today, so I really appreciate the expertise that you've all provided today. This is a tough question, and we like to look to you as industry leaders for your intuition and instinct, because I really think that's all you're going to be able to answer this on. And we ask this question all the time, so it's nice to just kind of see how the answers have moved through the months. But looking into your crystal ball, which I forgot to send them to you, I apologize. What do you see for our industry in January of 2021? Do you think we'll be back to business as usual? Do you think we'll be where we are today? Do you think we'll be somewhere we've not been before? Just give us your thoughts on and we're talking about January now of the coming year. Crystal ball, remember.
Who wants to go?
Nobody wants to go first.
You get to go first, Andrew, because you asked.
There you go.
Thanks.
All those in
That
favor?
means you want to go.
Well, I would say it won't be business as usual. In a previous answer, I tried to talk about two time frames, one with the uncertainty level that we have now, and one when there's a little more certainty of what the future will bring. If that happens around January, I'm not so sure. But what we do know is the longer this period goes on, where the danger level is elevated and people are still being quite cautious, the longer that happens, the slower the recovery afterward will be, because the deeper will be the recession, right? Most people, if things start to recover more quickly, will have disposable income. Those who are unemployed will become employed. But if that period gets extended by the lack of effective treatments, by the lack of a vaccine, those people, when things start looking better, may have their funds really exhausted, or their spending patterns already wound down to, feeling like we're poor for a while. We can't really afford to travel or to attend these things, or, et cetera, or we'll drive to Michigan rather than fly. From the polls that I've read of consumer research, it's kind of what we're seeing play out now. Drive to markets, leisure travel is coming back. Business travel, they say, won't be back until there's more certainty about being able to come and go quickly and sort of get in and out and do your business and not take dramatic risks with your health. International travel will be the last to come back, they say. They're talking now about bubbles of, if South Korea and Taiwan both have the same level of prevention and taking similar measures, that they allow travel between those 2 points, but not necessarily to Vietnam or some other third country. So things like that are popping up on a bilateral instead of multilateral basis like we're used to in the past.
Okay. Patty or Sean? Crystal ball time. Though, Patty, I want to give you some props and tell you that somebody commented that you already have one based upon the article you wrote in fall. So that was in the chat.
And it's a pretty good one.
I'll go ahead and do my crystal ball thing. I think that the new normal, whatever that means, is going to look different. If we look at like 9/11 and the events that happened after 9/11, it changed our security needs and rules for different venues going forward. And we had one wake-up call with Ebola, but Ebola was different. Even though it's a horrible disease, it was different. It didn't affect everybody like this is affecting. And then with COVID-19, what we're seeing is what a lot of folks, Bill Gates, Lori Garrett, my article, what we talked about is that there is this possibility that if something like this happens, luckily the mortality rate is low. And, when compared to some other things that it's going to have lasting effects. And so if I'm looking at January of 2021, and all of a sudden we have a flu outbreak, people are going to panic. People will panic, is this COVID-19? Because a lot of those symptoms are the same and similar. We're going to see, do I think that it's going to go away anytime soon? Probably not, because it's so widespread worldwide. If you look at that, you're going to see cycles for a while. Dr. Jay Varkey from Emory did an article with CNN, or an interview with CNN. He goes, first of all, folks, it's not that difficult. Wear your masks. Even if it's short term, wear your masks, wash your hands. It's not tough. no shirt, no shoes, no service. It may be now, as Sean was saying, no shirt, no shoes, no mask, no service. And that can be maybe a temporary thing. The other aspect is, even if we have treatments, and even if we have a vaccine, think about how well we do with vaccines here in the United States. How are we going to do that? A vaccine works if you take it, and it doesn't work if you don't. And the herd immunity only happens if you have a certain number of people who are able to take that vaccine. And so we've got a lot of parameters to work through. And so I hope that we learn the lessons through this to look at what types of things do we need to put in place, so that even if when we recover from COVID-19, if a really bad pandemic flu comes 2 or 3 years from now, that we're prepared to not have to shut down, to be able to respond to this appropriately, to remember those behaviors that we need to have, and also to have our facilities and businesses ready.
Thank you. And Sean, we'll conclude with your crystal ball. This is like the second or third time you've done this. You're mute. We can't hear you. We can't hear you.
You couldn't tell what this meant?
No.
What I said was,
so I might know.
This time you put me in the enviable spot of following someone who actually owns a crystal ball. Chuck, that's not a good spot to be. But your question is tough, because you actually put a couple things on there. You said, well, tell me what's going to be going on in January, right? And that's a long ways away, but also just around the corner. And of course, it's also pretty broad. So I think for me, I think a lot of things will stay the same, and a lot of things will be different if I'm allowed. Here's what will stay the same. We will hear that this will be the end of live meetings as we know it. We will hear that environment is going to change forever and it'll never recover, et cetera, et cetera. And I think also, just go back to the last global recession, and there was never going to be another group meeting face to face again. And what happened once we got our legs under us, longest period of sustained growth in our lifetime. So we will get there. I love the perspective Patty brings, because she plays into this an awful lot of kind of what ifs. And I hope that is something that stays. Short term, regional, hybrid, sure. Some confusion, because I think buyers and suppliers right now have to connect on what do you want versus what are we able to do. I think short term, but longer term, Patty brings some what ifs in there that are really good to think about, that we never did think about. So will that be different? Sure. Will our sustainability and sanitation approaches be different? Sure, longer term. Will the legal discussions change based on all this? Sure. All of that stuff will be very different. So it'll be an interesting point where we get to in January. But if you ask me to put a pin in it, I think we're still at a point where you're at the regional hybrid events, and the buyers and the suppliers are still trying to feel each other out as far as what the best product delivery could be.
Thank you so much.
Yep.
I wish we didn't have to have this conversation, but I agree with I really liked this panel discussion, because there was a lot of really good information and contributions from all of our panelists. And the one thing I really think I got out of this is that this is not a destination, it's part of a journey. And that what we learn from this, we need to carry forward, because this is not the last time. And we will always be faced with things that are unexpected or untested or unknowns. As long as we take the time to learn about each one and carry that on into the future, I think that's how we'll be successful. Let's not be naive and think this is the last pandemic we're going to face, right? So it's really appreciate everyone's contributions. I also want to just let everybody know, this is our page about our partnership with the Global Biorisk Advisory Council. It goes more in depth into the information about it. I don't see the URL for it. Allison, can you tell us what the URL is? Because it's covered up on my screen.
It's in chat.
I put it in the chat.
Okay, great. And so you can learn about the online individual fundamentals course, and also the accreditation program as well. And just when you go in and register, it's all caps, all one word. The code is unique venues. Unique venues is the code that you put in there. So thank you so much for everyone's contributions today, and we wish you well.
Thank you very much.
Thank you.
Thank you.
Thanks, everybody. Thanks, Chuck.
And just a quick reminder to everyone, thank you also to the panelists from me. This was a great conversation today. We do have more webinars coming up. You can see the list here. Part 2 of our virtual hybrid meeting series is tomorrow, June 17th, and with the final one on July 9th. We've got some business essentials coming up on sales and customer service towards the end of this month and into July. And as usual, we'll continue to run our member group therapies and planner roundtables. You can see we've got some breakouts coming up for MGT between campus and non-campus venues. Planners, again, you get your chance to get together and talk and vent and brainstorm on June 24th. All those times are 2 p.m. Eastern. You can register for all of those activities on our resources page, which you see the link there below. And with that, oh yeah, go ahead, Chuck.
Joel, can I ask one quick question? If there's anybody on here from Chicago, my email address is chuck@uniquevenues.com, and part 3 of the hybrid session is actually going to take place in Chicago on, I believe it's July 9th, Joel, if you can verify that, at 1 p.m. Central. And we are looking, I am actually flying to Chicago, and I will be presenting as a live presenter in a room in Chicago. And we are looking for 10 volunteers who are willing to come and be live participants in a safe practice, socially distanced meeting space in the city. So if you are somebody in that area who would like to come and participate live for that part 3, chuck@uniquevenues.com.
Excellent.
Thank you.
All right. And again, thank you everyone that has hung on all the way to the end. Thank you to our panelists, and we will see you on a future Unique Venues webinar. Have a great afternoon.
Bye-bye.
Bye.
Bye-bye.